Imagine this, your strength, the very thing that lets you walk, stand, even just lift your arm. What if it could suddenly vanish? Just switch off, like a light. That's what we're going to get into today. A mysterious condition called periodic paralysis, where a person can be left completely conscious, but utterly powerless.
That right there, that's a real quote from a patient. It's not from a horror movie. One minute, they're enjoying a night out. The next, this terrifying paralysis sets in. This is the central mystery we're going to unravel today. How can your own body suddenly, and so completely, betray you? So how does this happen? I mean, how can a body that feels totally fine one minute just stop working the next? It's a question that has stumped patients and doctors for more than 100 years. Let's go find the answer. Okay, so let's talk about what an attack actually feels like. A lot of times it starts at night or really early in the morning. Maybe you just feel a bit of fatigue, but then this weakness starts to creep in. It usually begins in your legs and just spreads upwards until you're in a state of flaccid paralysis. And here's the most chilling part. You are completely awake. You're aware, you can feel everything, but you can't move. You're basically trapped inside a body that has stopped listening. Now here's where it gets really, really interesting. These attacks, they're not random. They're actually provoked by very specific things. We're talking about stuff like eating a big pasta dinner or resting after a really tough workout. Even stress or fasting can trigger an episode. This was a huge clue for early researchers. It suggested the problem wasn't the muscles themselves, but something going on with the body's chemistry. And the big breakthrough? It came when scientists connected these attacks to one crucial electrolyte, potassium. They found that during a paralysis episode, the amount of potassium in the blood was either way too low or, weirdly enough, way too high. This discovery was the first real key to unlocking the whole mystery and figuring out how to classify the different forms of this condition. And this, right here, perfectly illustrates what's called the potassium paradox. On one side, you've got hypokalemic periodic paralysis. That's the low potassium kind. It's triggered by things that make potassium rush into your cells, like a meal heavy in carbs. And these attacks tend to last a while, sometimes for hours or even days. Then, on the other side, you have the hyperkalemic form, high potassium. Here, triggers like fasting cause potassium to rise in the blood, but the attacks are usually a lot shorter, less than 2 hours. So, think about that. Opposite problems with potassium are leading to the exact same paralyzing result. How is that even possible? To understand that, we have to zoom in. I mean, way in. We have to go from the whole body all the way down to the microscopic level of a single muscle cell. Because the problem isn't with the muscle fiber, you see. It's with the incredibly complex electrical wiring that tells it when to contract. And that wiring? It's all about these things called ion channels. The best way to think of them is as tiny, electrically controlled gates that are embedded in the wall of every muscle cell you have. You've got gates for sodium, for calcium, for potassium, and they snap open and shut with unbelievable speed. This lets charged particles rush in and out, and that's what generates the electrical spark for every single movement you make. Normally, the process is just beautiful. A nerve signal arrives, it tells the ion gates to open up, ions, mostly sodium, flood into the cell, which changes its electrical charge. And that electrical jolt, that's the signal that makes the muscle fiber contract. It happens billions of times a day without you ever thinking about it. But in periodic paralysis, this perfect system has a tiny fatal flaw. And here it is. This is the core scientific insight from one of the leading researchers in this field. The genetic mutations that cause this disease don't make the main gate get stuck open or closed, which is what you might expect. No, instead, they create an abnormal leak, a tiny second pathway, right in the machinery that operates the gate itself. This tiny, abnormal leak is called a gating port current. It's this incredibly small, constant trickle of ions that's just always there. Let me give you an analogy. It's like having a slow, invisible leak in a car tire. Most of the time, the tire works just fine. You wouldn't even know it's there. But if you hit a very specific bump in the road, like a sudden drop or rise in blood potassium, that tiny, constant leak is suddenly enough to make the entire tire go flat.
So let's walk through that chain reaction. First, you get the trigger, say low potassium. This changes the whole electrical environment around the muscle cell. Suddenly, that tiny constant leak from the faulty gate becomes a big problem. This leak causes the muscle cell's membrane to get stuck in a sort of electrical on state. It can't reset itself. And here's the final blow. Because the membrane is stuck like that, the normal sodium channels, the ones that fire the muscle, they can't reset either. They just shut down. And just like that, the muscle fiber is electrically silent. It's paralyzed. For a very long time, the thinking was that once an attack was over, that was it. Everything just went back to normal. But now we know that's not the full story. The focus is starting to shift from just the temporary attacks to the permanent and often overlooked consequences of this disease.
And this is a really critical point. While the paralysis itself is temporary, the disease can cause lasting damage. Over many years, a lot of patients develop something called a progressive myopathy. This is a permanent muscle weakness where the muscle tissue itself is slowly replaced by fat. And the most alarming part? This can happen even if a patient has very few attacks.
And this data from an MRI study is it's mind-blowing. As you probably expect, 100% of the patients who already have permanent weakness show this fatty replacement in their muscles. No surprise there. But look at this. 58% of patients who feel perfectly strong between attacks, who have absolutely no clinical weakness, also show the same damage when you look at an MRI. This proves the disease can be causing this silent, progressive damage even when you feel totally fine. So this brings up a huge challenge, right? How do you diagnose a disease that only shows up in episodes and can cause hidden damage when the patient feels completely normal? Well, today, doctors have a pretty sophisticated toolkit to find that tiny underlying fault. It always starts with good old-fashioned detective work, a detailed patient history, trying to pin down the triggers. After that, the most powerful tool is genetic testing, which can find the exact mutation. If that doesn't give a clear answer, doctors might use something called a long exercise test to actually provoke a response and measure a muscle's electrical output. Or they might use an EMG to look for other clues, like muscle stiffness, which can point towards the high potassium form. Of course, getting a diagnosis is one thing. Living with the condition is another thing entirely. The good news is, once this specific type of periodic paralysis is known, there are really effective strategies out there to manage it, to prevent attacks, and to protect the muscles for the long term. And the treatment is basically a mirror image of that potassium paradox we talked about. To stop a low potassium attack, patients will take potassium supplements. To stop a high potassium attack, they might actually do some light exercise or eat a snack with carbs to help drive that extra potassium back into their cells. And for prevention, there are medications like dichlorphenamide that work for both types, and then diuretics that can be used to either hold on to potassium or get rid of it, depending on what you need. But medication is only half the battle. Lifestyle is it's absolutely critical. It all comes down to avoiding those bumps in the road we talked about. So, steering clear of dietary triggers, managing exercise with careful warm-ups and cool-downs, eating regular meals, it's all part of a plan to keep the body's delicate electrical balance right where it needs to be. So there you have it. Think about the journey we just took. We went from this terrifying, overwhelming experience of a full-body paralysis, and we tracked it all the way down to a tiny, invisible leak in a single protein gate on a single cell. It's just a remarkable story of how science can connect a life-altering symptom to its almost unbelievably small cause. And that kind of leaves you with this one last thought. Our ability to move, to act, to just be. It all depends on this incredibly complex and maybe fragile biological machine working perfectly. And if one single leaky protein can bring the entire body to a grinding halt, what other hidden microscopic mechanisms are quietly governing our every single move?